HIPEC stands for hypothermic intraperitoneal chemotherapy. Hypothermic means hot, intraperitoneal is that which is given into the peritoneal cavity, and chemotherapy is drugs that are used to kill the cancer cells. So essentially HIPEC comprises of circulating a hot chemotherapy solution in the abdominal cavity or the peritoneal cavity. HIPEC is a surgical procedure. It is performed in the operation theatre after cytoreductive surgery. By cytoreductive surgery, first all the tumor is removed from the peritoneal cavity and then HIPEC is performed. A specialized machine is used to circulate 2 to 4 liters of hot fluid containing a chemotherapy drug in the peritoneal cavity. This is carried out for 60 to 90 minutes depending on the regimen that is used, the tumor that is being treated, the drug regimen that is being used, and the drugs itself that are being used to perform HIPEC. HIPEC is performed only once during surgery. Multiple applications of HIPEC are not performed. However, when the tumor recurs or the patient develops a recurrence, and if cytoreductive surgery is performed again, then HIPEC may be combined with it. There are many theoretical benefits of HIPEC. There are 3 components. One is the heat or hypothermia. The second is perfusion, that is circulation of fluid in the peritoneal cavity. And the third one is the chemotherapy drug or drugs that are used for HIPEC. Coming to heat or hypothermia, heat itself is cytotoxic to cancer cells. At normal temperatures, cancer cells can survive, but when they are heated beyond a certain temperature, cell death occurs. The other advantage of heat is that it potentiates the action of the chemotherapy drugs. There are many drugs who get potentiated by hypothermia. Certain drugs like cisplatin, hypothermia reduces the resistance of the cancer cells to that particular therapy. The next important component of HIPEC is the perfusion. That is the circulation of the solution in the peritoneal cavity. Now, when cytoreductive surgery is performed, a lot of microscopic disease or free cancer cells are shed in the peritoneal cavity. These cells, if not removed, will implant in the peritoneal cavity itself and lead to recurrence. HIPEC has the advantage of removing these free intraperitoneal cancer cells by perfusion. The third component of HIPEC is the chemotherapy drugs. Now, when drugs are given directly into the peritoneal cavity, there are many benefits. One is that they could directly reach the tumor cells, and the concentration of the drug in the tumor cells could be more than when the drug itself is injected into the vein. Secondly, because of something known as the plasma peritoneal barrier, some of the drugs are retained in the peritoneal cavity for a long period. That is, they will not enter the systemic circulation and produce some of the common side effects of IV chemotherapy, like a fall in blood counts or hair loss or nausea and vomiting. There are certain cancers in which there is a definite benefit of HIPEC. There are 2 rare tumors that seem to benefit more from HIPEC. The first one is peritoneal mesothelioma, a rare tumor that arises from the peritoneal cavity itself. And the combination of cytoreductive surgery and HIPEC could be potentially curative for some of these patients. The other cancer that benefits greatly from HIPEC is a condition called Pseudomyxoma peritonei. This is a tumor in which there is accumulation of jelly in the peritoneal cavity, and in 95% of the patients, the origin of the tumor is the appendix. That is, there is a jelly-like tumor in the appendix which ruptures and spreads to the peritoneal cavity, producing Pseudomyxoma peritonei. And cytoreductive surgery combined with HIPEC has a definite survival benefit in these patients. For ovarian cancer, there is only a selected group of patients for whom we have evidence for the benefit of HIPEC. These are patients who present with advanced ovarian cancer that cannot be removed completely. These patients are given a few cycles of chemotherapy and surgery is performed after that. At this time, if HIPEC is added to surgery, then the survival of these patients is increased at least by 1 year, or in some of them even more. Coming to colorectal cancer or colon cancer, that is a common cancer that spreads to the peritoneum. As such, we do not have definitive evidence that shows the benefit of HIPEC. But there are some tumors like mucinous tumors that could benefit from the addition of HIPEC to cytoreductive surgery. In stomach cancer, again, the evidence for HIPEC is limited. There are some studies that have shown that the addition of HIPEC to cytoreductive surgery leads to a longer survival compared to patients who undergo cytoreductive surgery alone.